Hi, I'm presenting a summary on the characteristic of renal replacement therapy in Saudi Arabia. I'm nephrologist and the executive director of clinical services at the Saudi Center for Organ Transplantation. The Saudi Center for Organ Transplantation is the governmental body supervising activity related to donation and transplantation, and also on national registry. So as disclosure, I have nothing to declare, and you are welcome to share this detail of this presentation on social media. So we use this study as a cross-sectional based on a questionnaire filled out by dialysis center in Saudi Arabia. So at the beginning of the year, this annual questionnaire will be sent to all dialysis center via mail, fax, email, and once the questionnaire were filled, it will be sent back to Scott and then will be encoded for analysis and validation. And once validated, a final report will be made for the national data. So our questionnaire, it contains 4 entities. The first one, information about the staff, about the machine and capacity in every dialysis unit and type of dialysis machine used. The second part is about the quality care management on patient by looking onto anemia management, phosphocalcic balance, hepatitis, and then about mortality, morbidity, risk factor, the presence of diabetes, hypertension, and the last part about renal transplantation and to censor how many patients went abroad for outside the country for kidney transplantation. So here as the validation, we have out of 278 dialysis units, 94 of dialysis units reply to this cross-sectional study, and it contained 98% from the total dialysis population in the country. Here is the summary of our hemodialysis population. Out of 19,522 patients on regular hemodialysis treated in 278 units. So we have the categorization about healthcare sector, even it is Ministry of Health or other governmental or private or charity, to look into distribution of manpower and population. This is the trend of new hemodialysis patients registered every year. Last year, we recorded 4,146 patients enter in the dialysis program. And as age group distribution, interesting to mention that below 14 years as pediatric, only 12 patients on hemodialysis program. And the majority of our patients, almost 70%, their age were between the group 26 to 65. And currently we have significant increase in the number of patients over the age of 75, 1,924 patients on dialysis over the age of 75. As vascular access, 62% with arteriovenous fistula, and only the graft used in 5%. Here is the causes of renal failure and prevalence of diabetes and hypertension. You can see here 43% of our dialysis population caused by diabetic nephropathy, followed by another 34% by hypertensive nephropathy, and then 13% with unknown etiology or glomerulonephritis. And if we look on the prevalence of diabetes and hypertension in our dialysis population, 70% of our dialysis population are hypertensive, and 54% of our dialysis population are diabetic. And we have the category of 39% would have the diabetes and hypertension. As management for the anemia, 74% receive erythropoietin. And hepatitis prevalence for HCV positive antibody is 8% of our dialysis population, and only 3% in HBs antigen positive antibodies. Then we have all this information sensor according to the health sector or the region or even the city to look into number of patients, the manpower, nursing staff, patient with diabetes or hepatitis according to any categorization. The same data is collected for peritoneal dialysis. And last year, we have a total of 1,545 patients on peritoneal dialysis. 14% are pediatric, and 32% are diabetic under the peritoneal dialysis program, but only 2% with HCV antibody positive, and only 15 patients, 1% with HBs antigen positive. So we have the distribution of our dialysis patient and modality of treatment, the majority under the automated peritoneal dialysis compared to CAPD. And here we have the trend of new dialysis population added every year. Last year, we censored in positive annual increase around 2.6% added to the dialysis program. And here the trend of kidney transplantation and patient followed post-transplant kidney transplantation. We have 7,000 patients on follow-up post-kidney transplantation. As prevalence, we have a mean prevalence of dialysis population 631 patient PMP, and the incidence of treated patient by dialysis is 142 PMP. As kidney transplantation, we have the 16 active centers distributed all over the kingdom, 12 as governmental and 4 private practicing only living kidney transplantation. And the total, we achieved more than 10,000 living kidney transplantation since we started the program. And we have a deceased kidney transplantation around 3,500 kidney transplantation. And you can see here the last year as example, we performed a total of 549 kidney transplantation compared to the over 1,000 per year the year before. And this is due to the COVID era we faced in the year 2020. If we look on the international chapter to compare our modality with the USRDS, you can see here Saudi Arabia, 30% in blue practicing the kidney transplant, and remain 70% by in-center hemodialysis and only 10% as peritoneal dialysis. As kidney transplant, Saudi Arabia performing around 32 kidney transplant per million population per year, knowing that the highest country is around 50 to 55 kidney transplant per year, but the majority of our kidney transplant in the form of living kidney transplantation. Thank you for your attention.